Welcome to Her Weekly Fix. I'm Dr. Laura Pipher, naturopathic doctor, and every week I'm here to give you a quick, no fluff dose of the latest health insights, science fact tips, and real world solutions to help you feel your best. Whether it's tackling hormonal chaos, digestive struggles, or low energy, we'll break it all down in 10 minutes or less. Let's get into this week's fix. If you've ever walked out of your doctor's office feeling brushed off with, that's just a part of getting older, this one is for you. This past May, Ontario Health released a draft Menopause Quality Standard, and it's a big step forward for women's health. It lays out what high quality care should look like for anyone experiencing perimenopause or menopause, and more importantly, what patients should expect from their providers. Today, I'll break down what this standard actually is, why it matters, especially if you're 40 or older, and how you can use it as a tool to guide real conversations with your provider. I'll link the document in the email so you can download it later, but in this episode, I will walk you through some of the key points. So, first, this standard is overdue and necessary. Menopause care has been inconsistent for decades. Some clinicians never bring it up, others rely on outdated information, and many women go years and even decades without a clear explanation for their symptoms. This standard aims to fix that. It calls out the variation and gaps in menopause care across Ontario and defines what good care should look like, from early identification to long-term support. Here's what the data show. Perimenopause can begin up to 10 years before menopause, typically starting in your early 40s. About 90% of people reach menopause between the age 45 and 55, and yet most are never proactively asked about their symptoms until they're already struggling. If you are 40 or older, your provider should ask about menstrual changes, hot flashes, night sweats, sleep, mood, vaginal dryness, and cognitive changes. And if they don't, this is your cue to bring it up. Now, we also know the standard defines 6 areas of care that you should expect. So these 6 quality statements are the backbone of the document, and here's what they mean for you. Number 1 is clinician education. This means providers should have up-to-date training in menopause management, including hormone therapy, non-hormonal options, and symptom assessment. And if your clinician doesn't feel confident, they should refer. Number 2 is identification and assessment. Starting at age 40, clinicians should screen for perimenopausal symptoms, not just wait for missed periods. And routine hormone testing isn't needed to diagnose menopause. Your symptoms and cycle history are usually enough. And if we do need to do testing, it's probably because you are below the age of expected perimenopause or menopause, and we want to make sure nothing else is going on. Number 3 is evidence-based information. You're entitled to reliable, science-backed information about what's happening in your body, from bone and heart health to mood, sleep, and metabolism. Education should also include lifestyle factors, treatment options, and what supports are available. Number 4 is managing vasomotor symptoms. Hot flashes and night sweats affect up to 80% of people and last a median of 7 years. The standard is clear. Menopausal hormone therapy is the first-line treatment when appropriate, and it should be offered after a personalized risk-benefit discussion. And if hormones aren't suitable or desired, there are evidence-based options that should be explored. Number 5 is managing non-vasomotor symptoms, because menopause is not just about hot flashes. The standard includes care for genitourinary syndrome of menopause, or GSM, which includes vaginal dryness, pain with sex, urinary urgency, as well as sleep, mood, and cognitive changes, and contraceptive needs during perimenopause, since pregnancy is still possible. Providers should address these as part of routine care. And number 6 is referral to experts. If your case is complex, early menopause, surgical menopause, or significant comorbidities, you should be referred to a clinician with menopause expertise. You do not have to just live with it. This is your checklist for what to expect and what to ask for. This is your window to optimize, not just survive. The standard echoes exactly what I teach in my Her Method programs. Perimenopause and menopause are not just about managing symptoms. They're a critical pivot for metabolic health, bone health, and cardiovascular health. And this document emphasizes this as a window of opportunity to strengthen your long-term health foundation through regular physical activity, resistance training to protect muscle and bone, nutrition focused on protein, fiber for metabolic stability, limiting alcohol and tobacco use, and prioritizing sleep and stress regulation. This is the science behind why all of this matters. Menopause isn't a side topic, it is a major health transition that affects every system in your body. This Ontario draft standard finally puts that front and center. Use this as your roadmap. Know what to expect, know what to ask for, and know what quality menopause care should support your whole health, not just your symptoms. So today, I want you to do three things. Download the standard, which will be found in the link. Number two, write down one symptom you've been brushing off and plan to bring it up at your next visit. Number three, send me a DM on Instagram at Dr. Laura ND with your biggest menopause question. I want to know what you're navigating and what's still not being talked about. Your care should always reflect your stage of life and your health goals. You deserve care that's proactive, personalized, and rooted in evidence. And this new standard is a small step in the right direction. Thank you, and we'll see you on next week's Fix.